Christine from M13 told me about Kanishka. I was like, we have to have this guy speaking at our event. Carenostics, I think, is one of the coolest health tech startups out there operating in the AI space. So without further ado, Kanishka Rao, the co-founder and COO of Carenostics.
Thank you. This is awesome. So when they say 3 minutes, is that 3 minutes left or 3 minutes in? Perfect. Awesome. Well, thanks so much, folks. I'm really excited to be here talking about Carenostics and how we're leveraging AI in a healthcare setting. I think we've talked about a lot. You hear a lot about where people are talking about AI. You go to all these conferences, and I feel like in the clinical space or in healthcare in general, people are typically, I love the way someone said this once, talking about swivel chair jobs. Where can you automate things that are administratively done, where things that are taking up time, and how do you address those with AI, specifically generative AI? Where my vision starts is actually the other side of the house, which is the clinical side. How can you leverage AI to make better care decisions? It all started very personal for me. About 3 years ago now, my grandfather unfortunately passed away from kidney failure, but didn't know he had it until his kidneys had already failed. And that was kind of my wake up call to just how many patients go undiagnosed and undertreated with chronic diseases for far too long. Because if you're able to identify these patients earlier, you can actually intervene and slow and stop the disease progression and help drive these better outcomes. But physicians need help because this is unfortunately a very common problem. Over 100 million Americans have an undiagnosed or undertreated chronic disease. And of the 4.1 trillion in medical costs, 90% are associated with chronic diseases. There's clearly a problem here that needs to be addressed. And frankly, the lack of intervention on chronic disease drives the vast majority of problems in healthcare, as alluded to, mortality, morbidity, but also all sorts of problems with complications in the health system, people unfortunately getting admitted to the hospital, all sorts of preventable exacerbations, as well as impacts, to the health system finances in terms of quality metrics and total cost of care overall. And so this is where we started on our journey to tackle this problem. And the first thing you need to do in healthcare is assemble the right team. And fortunately, I lived with one of the perfect people to do this with. My co-founder is my dad. And he's a PhD in machine learning and AI from back when I didn't know they had machine learning and AI. He wrote his first paper on healthcare AI in '95, which was the year I was born. And so fantastic teaming up with him and all the other people we've brought to bear, leaders in healthcare and AI, some of the pioneers from across the industry who've been doing this for decades to help tackle this problem. And really what we sort of came down to is where can we help? Where do you stop the problem of my grandfather from happening again? Well, it's you find these high-risk patient cohorts, and then you actually do it in a way where you can help the health system intervene. And that's the mission we set out for with Carenostics. Can we find these high-risk populations? Can we help the health systems intervene? And we've been able to do this with some of the leading healthcare institutions in the country, closest to here, Hackensack Meridian, which is the largest health system in New Jersey. And I've been fortunate over the last couple of years to be recognized for this, most recently at Health last fall, winning the Best Use of AI and Health Tech Rising Star Award out of 450 companies, which we're very proud of. But really, it all comes back to what impact are we trying to have? And this is where there's a couple of different problems that AI can help tackle. One of the studies that really resonated with me that I read recently was if a clinician was to do all the guideline directed things that they could do with their patients, their workday would be 27 hours long. And then you tack onto that the fact that they have 6 minutes per patient in these visits, and the fact that data is proliferating and growing at a rate that's simply unable to be addressed, to a lot of what Katie was talking about in terms of how do you find that and make that more accessible. But this is where you can help assist them with AI to be able to comb through that data to not only identify these high risk populations, but also identify which ones are at risk of progression, what's the right way to treat these populations, and then ultimately, can you help summarize the relevant information to the clinician to drive this intervention earlier? And so at Carenostics, we take a comprehensive view of this. You have to start with identifying these high-risk patient cohorts, but the journey doesn't stop there. You actually have to help assist the physicians and the clinical teams in actually making the right decisions. And then when you find, it's a great thing when you hear these AI companies saying, we found, 10,000 more chronic kidney disease patients that need to be intervened on. I don't know if you guys have tried to get a specialist appointment recently, but there's a long wait list for those things. So how can you actually optimize the clinical capacity to actually help drive those patients in and make room for those patients? And so these are all areas that we're tackling and leveraging AI, mostly predictive AI in the first bucket, a lot of work stream and care pathway navigation on the last one of bucketing. But in the middle bucket, since it's called the Gen AI Salon, I'll talk a little bit about how you can leverage how we're leveraging generative AI to help tackle some of these problems. I'll start with the personal story I started with, which is chronic kidney disease, where we helped identify patients who have undiagnosed and undertreated chronic kidney disease. And there's a variety of risk factors that are able to be found. Diagnosed diabetes, hypertension, obesity, old age. But if you flag every patient who has one of those things, you're flagging half the population at the health system. And then you drive alert fatigue and you have all the problems you have. So AI can help risk stratify that population to the relevant one. But then equally important is how you present that information. And so with AI, we were able to, in generative AI, you're able to extract the relevant information, as Katie was talking about, to be able to make the decisions on those populations. And when we did this for chronic kidney disease, what we saw was industry-leading adoption rates of a solution like this, where if you can actually give the physician all the relevant information to make the clinical decision at that point in time, we drove more than 70% adoption of these sorts of interventions. And actually, this was just presented a week ago at the AMGA, the American Medical Group Association down in Orlando, by our partners at Hackensack Meridian. And if any of you are familiar, the typical adoption rate of alerts and things like that is in the 10 to 20%. But this is where AI and, generative AI to get the right information can really help accelerate that in terms of helping the clinicians have the most relevant information available to them at the point of decision making. The other thing I'll just talk about quickly is, we've taken this to other diseases like severe and uncontrolled asthma, where you can actually save physicians a significant amount of time in these evaluations by doing things exactly like Katie talked about, of summarizing the information. And so that's where, we're able to pull out the relevant information that they'd otherwise have to dig around within the EMR to find. And this is another way that AI can help with that middle layer of actually helping physicians make the right care decisions at the right point in time for the patients. I'll just conclude by saying, the way we're trying to tackle this of early intervention on chronic disease is truly where I see the win-win-win-win-win in a broken healthcare system, and where we're trying to, within the way healthcare is today, actually drive the impact that we know needs to happen. So thank you.
Thank you, Kanishka. Love the story behind what you're building.